are back here with Dr. Luther here on Healthy Living, and we're talking about, well, I could talk all day to you just because you're absolutely fascinating, and I think your philosophy on health and wellness really embraces where I think many of us want to be right now. And I think you and I talked a bit about it, that this virus has helped a lot of us sort of reboot, for lack of a better phrase. I'd like to know a little bit about telemedicine, because you said that's been something important in your practice recently.
Yeah, it's actually, been a thing that has been a very nice tool to help and reach a lot of people under this time. And most of the third-party payers are reimbursing for it like a regular visit.
Okay.
There's certain things that we can't do, such as the physical exam to a great degree. But
push and touch.
Yeah, the number one tool in the field of medicine since its invention has been the history, the conversation that you have with the patient. And it was ingrained in me in medical school that 90% of the time you should have the diagnosis simply by talking to the patient. If you don't, the other 10% is where you do the exam and order testing.
Are we good historians of our own self, of our own body, or is that part of the art of what you do also, is being able to ask questions that lead?
Yeah, and I respect the fact, and I like to tell people to help them feel comfortable, that you know your body better than a hospital full of doctors. You may not know what's going on, but if you can sort of describe to me what you're feeling, what you're experiencing, and then I'd need to try to synthesize that and ask more questions to better understand what you're going through, and then with that understanding, develop a game plan for either a diagnosis or treatment.
I've always wondered, we talk about history and intake as being, you said, a huge piece of the puzzle. What can patients be prepared with when they come to the doctor as far as information that you may be asking them?
Most of our offices, I think, these days do these pretty extensive intake sheets that talk about your demographics, your past history, your medications. If you give me a medication list, I can usually tell you the story of a patient pretty quickly. And so those are very helpful things. And then usually a person comes with a priority and trying to figure out what that priority is and what their purpose for being there is, and that's called the chief complaint. And so if you can start with that, and then develop the whole evaluation around that whole point. Most of the calls we get during the day are very specific. It's a sore throat, an earache, a cough, or whatever it is. And you start there, and then you just ask a series of questions to try to come down to a few diagnoses. And medicine is a field of probabilities. It's an imperfect profession, and it's practiced with fallible human beings. And so you have to look at things that are the most probable causes, and you start there. And that's the other axiom in medicine that, we talk about. If you hear something galloping down the street, it's probably a horse and not a zebra. And every now and then it is a zebra, but you first start with the horses. You start with the more common things. Common things present commonly. And so that's where you start.
When you do a complete physical, do you like to do them once a year, or just depending on the patient?
It just depends, and that's been a debatable subject over how important that is and how helpful that is. But, it is sort of, I kind of look at it as a state of the union, and certain things that you can evaluate and just sort of keep track of objectively year by year.
So more like a baseline. Look, if here, hi, nice to meet you, I'm your patient, let's get a baseline and see where you go from there.
Kind of go from there. That's it.
So what are some typical screening things that you recommend people do, or what are some important things to pay attention to?
And most of those are age-driven, and there's a United States Preventive Task Force that has a lot of good information in there that talks about what screening evaluations are appropriate. In medicine, there's no perfect test, and we're always looking for sensitivity, a test that will pick up a disease if you truly have it. And specificity, how specific is that test to tell you that you have that exact disease? There's nothing that's 100-100. So there again, you're sort of dealing with probabilities, but if you're going to be screened for something like colon cancer, you want to start with, you don't start with 2-year-olds because there's a very low probability that they have that. So then you start looking at the age categories where that is more prevalent, and that's where you start your screening tools and techniques.
And so for colonoscopies, is it 50?
Usually it's around age 50 that you start screening for colon cancer. If somebody in your family has had a primary relative with cancer, usually we start that 10 years sooner.
And then what about blood, taking blood tests, CBCs, things like that? Do you recommend every year, again, just to sort of see where you fall in there?
Certainly, and there again, looking for the more common things that we're seeing in our society with the metabolic illnesses, diabetes, looking for sugars, looking for lipids, things along those lines, and certainly we can factor in their kidneys, liver, regular blood counts, things along those lines.
Talking about nutrition, I want to kind of go back a little bit to that. I think it's really interesting that you're talking about these behavioral changes. How do you share with your patients ways to shift their behaviors? Because, good luck, right?
Yeah, that's a good point. I think trying to find out where they are in the game and what their current habits are, behaviors are, asking them to consider how that might help or hurt them long term, and there again getting back to starting with the truth and trying to understand that and share that truth with them. I oftentimes will recommend a particular book that they read if they have a particular interest in a nutrition plan and things along those lines. Knowledge is power, and the more you know and the more that you're sort of bathing your mind with those truths, then you're much more likely to adhere to them.
Now, we've been focusing on nutrition. Can we talk a bit about movement? Because I know you.
Well, our bodies are created to move in a variety of different fashions. And if you look at those basic functional movements, and for instance, like the squat, when you go down and you come up, that is a critical movement to have. If a person loses their ability to squat throughout life, they can't get out of a chair, they can't get off of a toilet, and so you're headed for assisted living. A lunge is another good thing that you can do as far as practicing functional movements. A push-up, many people can't go down to the ground and do a strict military push-up, but you could do one of those off of a countertop. Things that you think about that you need to function. And if you look at constantly varied functional movements of increasing intensity, you're basically taking the way your body moves and you put it against time, weight, or distance, and now you have an exercise.
Whoa.
In other words, if you take the basic air squat and do that, you can do that in your own living room. Do that for 20 seconds, rest for 10. Work for 20, rest for 10. Do that for 5 minutes, and you will have a very good functional workout.
Oh, I love the thought of functional workouts as we age.
Right.
I mean, I'm 67, so do I just pay more attention? Do I need to be a bit more careful, or I do what I can do?
It seems
because I want to do it right.
Yeah. And that's where, having a good trainer can be invaluable to look at that, and then looking at your goals, but focusing on the functionality of your whole body. As we mature through life, probably the number one threat to your viability and functionality is a fall.
Fall risk.
A fall and a break. So doing exercises that would work on your ability to stay upright, to reduce the risk of fall, working on balance. Putting balance into your workout routine is good.
Yes.
Just brush your teeth on one leg and switch it around to the other. Those are good things to do. But
I know it sounds silly, but it really is, isn't it?
Yeah.
I watched my dad at 92, and he may feel yucky one day, but he's bound and determined, even on his walker, that he's going for a walk every single day.
And that's wonderful, and that's what you want to see. What is the purpose of exercise? Exercise is a stimulation to your body to prepare you to face another event in life, so to say. And so if that stimulus is not constantly varied and increasing in intensity, your body will adapt to that. Your body wants to be happy and comfortable. So if you take your same walk every day, that's great. You're getting off the couch, right? But maybe instead of just walking the same pace every day, you pick up the pace between two mailboxes. Vary that intensity. Give your body a little challenge. Maybe you lunge walk for a short period of time. Maybe you stop and do some push-ups on your walk, or do some squats, or do something like that will stimulate your body.
One of the things that I hear when you're talking is, and I know a lot of folks that I see, it's kind of an all or nothing. They've never done it, and now it feels like it's here.
Right.
What I hear you say is the opposite. Look, just this much between two mailboxes. Just do that. And it's not so daunting or intimidating. Do you find that that's one of the detriments, or one of the fears? We go back to the fears that you were talking about. I don't know if I can do it. What if I can't?
We have a thing called scalability, and basically that means that Our body movements are the same as an Olympic athlete. All right, so we will do the same kind of movements, we just won't do it in degree. And so an Olympic athlete may do a squat with 500 pounds on their back. You and I might do it with 35, 40, 50, whatever our bodies can handle. But that squat is the same element, basic functional movement that you need. And so what you try to do is find out where everybody is and scale it to them. They want a workout that's going to stimulate them. And then you factor in things like we were talking about there, you know, are you rested? Do you have good sleep? If you come into a facility and you're tired, that's probably not the day to try to do your personal best. You know, you want to try to scale that to adapt to where you are, or you will get injured.
I'm a big iteration. This is my first iteration of my workout. This is my next iteration, which means I can't really fail.
Right.
Because I'm just keeping...
No, you don't. There's no failure.
No.
Yeah, you just come in and you do it, and you work on trying to improve technique, you know, technique, mechanics, and then intensity. Once you have good technique and good mechanics, then you do need to crank up the intensity in order to get the stimulus your body needs to be stronger, faster, have more endurance or more power.
Okay, so here's what we've learned today. Dr. Stephen Luther is excellent at explaining and he's user-friendly. I really appreciate your time today, and we want to thank all of you for joining us here on Healthy Living also. Please have a wonderful week. Bye-bye.